Hey everybody, welcome to the Healthy SBC Podcast. I'm your host, Jeremy Sutton, physical therapist. I'm here with Dr. Mandy Crow today with Aline Health, and we're going to be talking about her practice, what she does, her philosophies, and things like that. So, Dr. Crow, thank you so much for joining me.
Thank you for having me.
Yeah, awesome. I'm excited.
This is exciting.
Yeah. So, first thing right out of the bat, I'd just like to get you to say, who you are and how do you serve people here at Aline Health.
Okay. So, Dr. Mandy Crow, I am born and raised here in Louisiana. I'm from Benton, Louisiana. I currently live Shreveport, Mooringsport areas. And I opened up Aline Health. It's a direct primary care clinic. I opened up this clinic. I think the number one goal was to have more time with my patients. So in a traditional clinic, I think we all have had that experience. You have to see a lot of patients a day, so the time you're able to spend with them is so little.
Right.
And so that was the main goal. It's like, look, I need more time with people. This is wearing me out. This is wearing them out. And, honestly, I wasn't able to do all the things in an appointment that I wanted to be able to do.
Right.
It takes a long time to talk about nutrition and movement and stress and mental health. And so that 5 to 7 minutes just wasn't cutting it. So that was the main reason I opened Aline Health, was to improve my quality of life, to improve the care I was giving to the patients, and to have more time.
Awesome. So do you feel like once you got into Aline, did that happen? Were you able to improve that quality?
Absolutely.
Yeah.
Now, it's been a learning process,
Right,
a growing process. This is lots of challenges in going out and opening your own business. But yes, I would hope that all my patients would say that too. And then the other thing about it is we're able to do things so much more efficiently and quickly.
Right.
So things that would take a patient a whole day to take off work to go do, or a whole morning, they text me, and in 20 minutes, I've told them what they need to do, a prescription's been sent in, and so we're able to do things more efficiently on that end too. So sometimes it's not long visits, it's just making their life easier.
Absolutely. I have a direct primary care physician too. I'm in Benton, so I have Dr. Flowers up there, who I know you know.
Love Dr. Flowers.
And so I love that I can text him, and he texts me back and says, "Yeah, go do this." So it's amazing, and I don't have to wait to hear back from him for like 3 days, because I think that's as physicians, you're so busy,
right?
And I know you have, in a regular clinic, you may have 100 people that you're seeing, and you're having to call them back. So I love the fact that he can spend more time with me, but he's there.
Have them out. Yeah, that's like we were talking about earlier. You can understand it's not putting anything on the doctors that are still doing that. You understand why they can't.
Right, absolutely.
They just are so busy, and you have so many patients, and then you have all these lab results you've got to check, and prioritizations to do, and phone calls to call back, and then you need a little time for yourself throughout the day. So I understand why I was there.
Yeah, absolutely. I know it. So why is direct primary care important to you? I feel like we just answered that, but just go a little bit more.
Well, I think on a more big picture thought, I see healthcare going in a very scary direction.
Yeah, absolutely.
So costs are increasing and outcomes are getting worse.
Yeah.
More chronic disease, sicker patients, more medicines, exorbitant costs. The doctors aren't happy. The patients aren't happy. Like, what are we doing?
Yeah.
So I did not come up with this solution. Many people and doctors who came before me came up with this solution, almost kind of going back to the way things used to be, of, hey, let's cut out all that fluff and administrative burden and middleman and costs that are going not to patient care, and let's just get it back to the doctor and the patient, having a relationship, exchanging a monthly membership, not waiting 6 months later to get back part of your bill or denied, or it's easier for both parties. And I feel like for primary care, they kind of liken it to car insurance. Mm-hmm. If car insurance paid for every windshield wiper blade that you had to change, every time you had to fill up your gas tank, every time, what else do you do to a car? Every time you had to change your oil.
Right.
If car insurance paid for that, the cost would be so huge every month. Well, that's kind of what insurance is doing. It's paying for every little tiny thing that really doesn't cost that much, but to do the paperwork, to do the billing, to it raises the prices artificially.
Sure.
So we're taking all that fluff out and we're providing primary care for the actual cost, and that brings down the cost of it.
Right.
And it improves the quality because you have more time.
Sure.
So it's like a win-win. That fixes both of those solutions.
Yeah, absolutely. And it de-stresses the doctor and it de-stresses the patient.
Absolutely. And, this may not be a popular statement, but what I tell my patients is, look, I don't want you to get less care. I want you to need less care over your lifetime. And that's the goal here, is not to deny or to, it's like, no, you just need, go spend your time doing something else than at the doctor's office, So let's prevent stuff, let's reverse things and de-prescribe and do things different.
Yeah, let's try to live healthier and do health care and not sick care.
Right.
Yeah, I love that. So what made you choose medicine in the first place as a profession?
Wow, that's going way back. I went to Louisiana Tech.
Yeah, me too.
Awesome. And I went, I think, if I remember right, I started in business.
Oh, wow.
And then I took a couple of biology classes and loved it. And so it just kind of sparked my interest of wow, this is a really neat field. Two things. One, my father committed suicide when I was 10.
Okay.
And so mental health was in my life, and that was really important to me. And then, this is kind of strange, but I dealt with acne my whole life. So I really liked derm because I felt like I knew how horrible that was. So I wanted to help other people. So between biology and then mental health and derm, it just kind of all fit, and I went down that path. And then, once you get into med school and residency, it all changes, and you have to kind of decide. And I know I wanted kids and a good schedule.
Right.
And so that's kind of, this is the best of both worlds because I can do all that.
Yeah, I love that.
Mm-hmm.
So a little confession, I wish I would have been a dermatologist because I really like cutting and pushing on people.
Yeah.
Anyway, that's just my problem. So.
I wasn't top 2 of my class, so derm was out for me.
I definitely would have made it then. So we've talked a lot about prevention before we started recording, and I know that's important to you. So let's talk about how do we prevent these things, and then we can specifically get into dementia.
Okay. So my whole career, I've been really focused on prevention, and I really didn't know I know that sounds a little odd, but I didn't really know a whole lot about it when I started to practice. I mean, of course, we had screenings and get your mammogram, get your colonoscopy, and all that was there. But we didn't have much in the way of nutrition education and movement, mental health. I mean, all these stress reduction, all these things that I've learned over time. And so my whole practice, I've always geared towards, let's talk about food as medicine. How can we prevent all these diseases that are happening nowadays? In the past, it was infections that hurt and kill people, but now it's chronic disease.
Right.
And a lot of that is preventable and reversible. And that discussion wasn't happening, and people weren't being told that, and so that just developed into something I was doing. And then it has morphed into dementia prevention. So I've been directly affected by dementia in my family currently. And so my passion has changed to, hey, does anybody realize that up to 40% of dementia could be prevented or delayed? And man, a lot of the same things that I've already been teaching people is geared toward dementia prevention, tweaking it, optimizing it, adding other things to it, but preventing dementia prevents heart disease, prevents diabetes, prevents high blood pressure, it just all trickles down. So that's kind of where I am now, is starting to turn my focus in my clinic to dementia prevention consultations.
Yeah, wow. I love that. So last 2 years ago, I stopped eating sugar completely for a while. And I was at 280. I'm at 240 now, so I've dropped. And just seeing what sugar does to our bodies.
Yes.
And how I feel different now. And all of January, I ate no sugar, and I felt amazing.
Awesome.
And so it's not awesome because I went back to eating sugar, but I go back and forth. But I do, I noticed one of the questions on your Vital Ops wellness app, and we'll talk about that in a second, was do you fast? And I do. A lot of times I do a lot of intermittent fasting, and at first I didn't like it, but now I feel so much better.
Yes.
And
clearer thinking and more energy.
And you know what? And now that you say that, I was telling somebody a few weeks ago that my creativity has been so much better in the last 6 months. And I really attribute it to, getting over some business failures and other things. But now that I'm thinking about it, and you just say this, because I haven't been eating sugar.
Yes, and we don't realize the huge effect it has on us. And unfortunately, too, a lot of times individuals don't know how much sugar they're eating.
Oh, gosh.
I mean, whenever I start to sit with a patient and say, okay, well, let's Google it and see what the nutrition label is, and you start to open their eyes of, oh my gosh, my sugar cubes over here, that one item is like eating 10 sugar cubes, and you start reading the labels and understanding carbs turn into sugar,
right.
Then there's added sugar. It's just, unfortunately, if you're not an informed consumer, you can very quickly have a ton of sugar every day and not even think about it.
Yeah, because there's, 100 names for sugar?
Right. And then the labels are confusing. I mean, it's just a mess. So, I mean, the easiest thing to do is stick to foods without labels.
Yes.
Whole food, real food, plant-rich, lots of plants. That's the easiest way to avoid that.
Yeah. Vegetables minus potatoes and corn.
Exactly.
It's like a sugar bomb.
Yes. And, like you said, I mean, and I tell my patients all the time, look, no one item is off limits.
Right.
It's not like you have to scorched earth, never have a X, Y, or Z again. Yeah. It's about understanding what you're putting in, following it over time, and drastically reducing it.
Yeah.
And it's amazing what happens to people's lives and the way they feel, and their weight, and their mental health. I mean, it's just all connected.
Oh, it's crazy. And I literally have not put that together until you just said that. Oh, that's why I've been creative. I haven't been eating sugar all day.
Awesome.
So you taught me. So why is prevention so important for the Shreveport-Bossier City community?
Oh, goodness. Well, I mean, unfortunately, Louisiana is kind of
ground zero
at the bottom of a lot of health outcome lists.
Yes.
And, I think, first of all, I'm just really passionate about this community. This is where I'm from. This is where my family is, my friends, my kids are growing up here. And I see on a daily basis the devastation all these things have on patients and individuals. And I see literally, like, my mom's having her leg cut off. That sounds, but that's the reality.
That's the truth.
That's reality.
Yes.
My dad's going on dialysis. My X, Y, or Z dropped dead from a heart attack. Sure. So it's devastating to hear these things. And now, can we prevent everything? Absolutely not. I would never say, you can prevent everything, or, trying to be too grandiose with what I'm saying. But what I am saying is we have a lot more control than we think. And you talk about costs of healthcare for Louisiana and where we're headed and where we're already at and over budget. And, I mean, you're talking about entities like schools and government agencies. And, I mean, our state is having to run a lot of this.
Sure.
And we got to do better.
Yeah, we really do. It's sad. I mean, my dad passed away in May last year, and he had COPD, and he never smoked a cigarette in his life, but he was a manual laborer and all that stuff, and then he ended up with a chronic sinus infection, and then he got pneumonia,
wow.
and he had cancer, and it just kept going and going and going, and finally, there was nothing that they could do, and he had he drank sweet tea all day every day, and I'm not going to get into all that, but there's things that we could do that say, hey, what if we look back 30 years ago?
Absolutely.
And say, hey, we know these things are stressors, and what if we cut that out or just do it a little bit differently?
And that's where I am with the dementia prevention. So we have unturned every rock to figure out, why does the person in my family have dementia? We couldn't figure, and then as we started to tease through, we're like, oh, here's this lab. He had this going on.
Right.
Sleep apnea, clogged carotid, elevated homocyst, like all these things. And we're like, if we could have 30 years ago done all these different things, not very hard, safe, low-cost things, where would we be now?
Yeah.
Now, we could never say that, oh, yeah, he wouldn't have gotten it, but we could say we were doing something actively to prevent it.
Right.
And we know that the changes in the brain that lead to dementia don't start when your symptoms start.
Right.
They start 20 to 30 years earlier.
Yes.
So if you wait until you have symptoms,
It's too late.
It's too late for prevention.
Yeah.
We're talking 40s, 50s, 30s.
Yeah.
We need to be aggressive about this and give people hope.
Yeah, absolutely. And that's what it is. It's hope. You're not bashing anybody. We're not
bashing. No.
We just want to do better, and because we are headed for a healthcare crisis in our country, and especially in our state, with the things that we're doing. And,
absolutely.
I mean, we've got to do better. And so the tests that you're talking about, where you start teasing things out, are those tests that normally people are getting tested on?
Well, unfortunately, no. They're not typically in a standard yearly wellness panel or at a standard office visit. I'm not exactly sure why that is. Well, I think there's a couple reasons. One, I think all this is so new, and it takes a lot of time and energy to learn all of this.
Yeah, absolutely.
And so I think some of it is just, if this isn't your passion, if this isn't what you're reading on every day, you may not know that as a medical professional. I think the second thing is, a lot of times, I'll just be honest, doctors are afraid to order tests because if the insurance doesn't cover it, then the patient's going to be stuck with a really large bill, and then they're going to be upset, and it's like this vicious cycle. And so if it's not covered in the standard wellness visit, I think maybe sometimes that's where the hesitation comes from. And then the other thing is, standardized outcomes. Like, okay, well, what level is optimal? Do we really have a standardized outcome for that? Are things in place? Have guidelines come around to say what we should do with this number? So I don't want to get all these values back,
and then we don't
know what to do with them. So right. I think there's multiple challenges there. The way I do things, I don't use insurance many times.
Yeah.
The patient just pays direct for their labs, drastically lowers the cost. And then we're able to order what we want, talk about them, and look, I have a conversation. Hey, look at what these studies say. I can't guarantee you this is what we're going to shoot for. This is optimal, not just normal.
Right.
And we can go around that.
Yeah, I think I was, listening to Outlive. I think it's Peter Attia, MD, and he talked about, sometimes they give you back, these are normal limits, but they're still not optimal. Like it really needs to be a lot lower.
Right. Or a lot higher.
And that's scary.
Depending on what you're talking about. Yeah.
That's scary. Like as a healthcare professional, that scared me. I'm like, oh my gosh, I need to go get all these tests done and see where I'm at. Because I don't want to. My grandmother is in a nursing home in Arcadia with dementia, and I go over there and talk to her, and she thinks my dad and his brother are teenagers. And it's and like you said, I can deal. If that was you, I would be fine because I'm a medical professional. But my grandmother, I just sit there and cry with her.
Yeah.
And she's like, don't cry. And I'm like, I can't stop. I'm sorry. I love you. It's just hard.
And the hard part is the patient is suffering too in their own way, but the caregivers and the family and the people around them, it's just devastating.
It really is.
And yes, with optimal labs, you talk about vitamin D, B12. I mean, there's just so many things that, a 20 or 30 may be normal, but really we want to see it 50 to 80, to really meet what the studies are showing us is going to prevent dementia.
Wow.
So you got to optimize.
So you're just like, you're good. You're basic.
Yeah.
No, we need to be more basic.
Yes.
So talk about the Vital Op Wellness app. I'm super excited about that. You just went through it with me. I know you're excited. So tell us about that, what it is, who it's for.
Yeah, so we got the app and then we got the dementia prevention plan. So we'll talk about both of those.
Yeah, absolutely.
Okay. So the Vital Op Wellness app, so me and my good friend Alicia Timon, she's an RN and she used to own Go Healthy here in town. We kind of were talking about all this, like-minded, and we were like, how can we reach more people? Like, I'm doing what I'm doing in my little clinic and seeing patients. She's doing what she's doing and seeing some patients, but man, this is not going to move the needle unless we get this information out. And so we were like, technology. We need technology to bring it to a lot of individuals. And so we kind of took what I do in my clinic and what she did in her clinic, and we put it into an app, and it's video-based. So the user will download the app, put in a lot of questions like, do you have diabetes? Do you have... What's your A1C? What's your LDL? Do you have high blood pressure? All these questions. And then it will put them on a wellness journey. So you'll get pre-recorded content coming from me and Alicia based on your disease process, talking about what is it? What can you do to prevent it? What can you do, not to prevent it, but what can you do to reverse it? What are labs that you're going to have during this condition? With diabetes, what are the complications? Because sometimes we don't do a good job at telling patients, this is the number one cause for dialysis in the U.S. This is the number one cause of blindness. These are really scary things that sometimes kind of get brushed over. All of that is in the app. Alicia is wonderful at motivating people, at helping them understand what are their barriers to making changes, how to make changes, quit making excuses, how to shop. There's tons of recipes. There's what do I eat? There's food lists. Just all kind of good stuff in there that it's not taking the place of anybody. It's in between doctor visits, in between nutrition visits.
It's a supplement.
It's a supplement. You can use it to kind of hold you a little bit more accountable in between, so you don't go back to that next visit and nothing has changed, nothing has happened, and you're adding another pill.
Yeah. So I love that idea. So I ended up getting an app that's an exercise app, and it has a million different videos on it, and I loved it, but it was like $40 a month. I was like, I don't want to pay $40. Is this something that's affordable, your app? Or
Yes, it's $9.99 a month.
Oh, wow. So
month to month, cancel anytime.
One day of Starbucks.
Yes. And that's what me and Alicia are like, if people, she talks about that all the time. Like, you will go spend crazy money on different things, but hey, is your health really a priority, or do you just say that?
Sure.
If it's really a priority, that's where your time, energy, and money is going to go.
Absolutely.
So we've got to change our mindset.
To eat out every day for somebody, like I drive all the time, and so when I was binging on food that I wasn't supposed to be eating, it was like $12, $14, $16 for a meal somewhere. A meal that's killing you.
Yes.
And it's $16. And so my wife was, one day my wife said, hey, we know who's spending all the money. It's you. You're eating out every day. And I was like, I know, it's crazy. Yeah. You're spending $100 a week on food, or you can spend $9, $10 a month on an app that keeps you healthy.
Yeah. And we've been kind of fed this lie. I feel like every time you start to talk about health food, it's too expensive.
Absolutely.
It's too much money.
Not.
Have you looked at how much a 12-pack of Cokes cost,
crazy.
Or going through the drive-thru, and you're talking about a 59-cent can of black beans, $1 bag of broccoli.
Yes. Yeah.
Maybe salmon might be $6 or $8 for a piece of salmon, or maybe even less.
Right.
No.
No,
that's an excuse.
I mostly eat lean meat, so I don't eat any grains or sugar, and so I hate cauliflower, but cauliflower rice, the bird's eye, I love it.
Yes.
Because it takes on whatever flavor you're putting on it.
Exactly.
And I go buy 2 bags of that a week, and then either like some lean hamburger meat or something. I cook everything on Saturday, and for $6 or $10, I've eaten the whole week.
Yes. It's
$10.
You can actually save money.
Yeah,
that sounds crazy.
Healthier.
Yes. Yeah. And the other part about that is, if we are filling up on fiber, and we're filling up on food that is not a quick energy spike and then dropping us, we're eating less.
Yeah, 100%.
We actually don't need as many calories as many of us are consuming in a day. So we're spending a lot of money on extra calories because we're hungry again. So if you eat more fiber, fill up that stomach, food is with you longer, you need less, it's healthier for you. It just is a win-win.
Yeah, and it makes sense.
Yes.
Awesome. Okay, so...
and then the dementia plan. Do you want to do that?
Yes, absolutely. Talk about that.
Okay. So that's the other piece. So we've got that technology, and then as I've become more passionate about dementia prevention, I was talking to my mom, my in-laws, everybody, let's all do this. And then it's like, wait a minute. I want everybody to know about this. So where did we go? We went back to technology. And so we've created a dementia prevention plan where you sign up, you pay for a plan, you input about 60 questions, and then it's going to spit you out a plan right then that'll tell you, what do you need to improve, what do you need to ask your doctor about, what labs are in the optimal range, and what do you need to continue to do. It's evidence-based, so 180 sources cited, so it's not just, what do I feel like today?
Right.
Yeah. And then it allows the patient to be empowered, or the user, we call, it allows you to be empowered, like, yes, I know this information, and now I can take it to my doctor or my health coach or my nutritionist, and we can work through this together, and I can slowly start to make changes. It doesn't happen overnight. Nobody expects it to, but hey, let's lay down a little bit each day, each month, each year, to where we look up and, hey, it's just my lifestyle. It's not a diet. It's not I'm struggling to make these. It's just the way things are.
Yeah, I love that. And is that a one-time plan, the test that they go through?
Yeah, so you can do it one time, but the idea is, hey, make changes 3 months later, come back and do it again and see how much you've improved. And then, of course, this is we call them like MVP, minimal viable product. This is just the beginning. So we're getting it out there, but we would love, to track and, add features to it over time, put in some risk scores and different things to make it more meaningful. But, hey, we just need to get it out, get people with this information, get started, and then we'll optimize it over time. But, yes, it's great information. I'm so excited. I want to give people this information all in one place, make it easy, and just show them, hey, there's so much you can do.
Yeah. And what's the cost on the dementia plan?
The dementia plan is $24.99 for one plan.
Perfect. That's again super reasonable.
Yes. And what I say is, look, so for that plan, if I were to sit down with an individual and do that plan, it would probably take me, I want to say at least 4 office visits, maybe 5 or 6.
Yeah.
To go through that amount of information. So the cost of that, I mean, $1,000. I don't know what that would be for that many visits. So you get all that in one plan. So.
Yeah. I think it's phenomenal. I mean, I don't know why we wouldn't use it.
Yeah.
I mean, it's there. So, I'm going to sign up and I want to see, because I'm literally listening to this book and it's talking about the APO4, all that stuff I had no idea what it was. I'm like, well, I probably have some of that. Like, I have dementia in my family, we have heart disease, cancer, all that stuff. I want to know. And I was literally driving around yesterday thinking, how can I get tested for all this? Well, here we go.
Well, there you go.
Awesome. So,
yeah, and I do think bringing up the ApoE gene, I do think that's important. We definitely discuss it in the plan, but we don't tell anybody you must go take that test.
Sure.
Like, that is one test that really should be a discussion between you and your doctor or a genetic counselor. Because there are some implications of knowing what your gene status is there. But there's lots of things you can do, even if you don't know.
Right.
You can make some of the changes that those with ApoE4 should do.
Sure.
So, but you talk to a provider, a doctor, and you can get that test and just be more informed.
Right. Talk to Dr. Crow.
Yeah. Or Dr. Flowers.
Dr. Flowers. all those good doctors.
Yes.
All right. So now it's time for the SBC Spotlight. This SBC Spotlight is brought to you by Aline Health Direct Primary Care Clinic. Dr. Mandy Crow, where access, price, transparency, efficient, and quality healthcare. And I believe it's $130 a month for your clients?
It is. Right now, I'm on pause of taking new patients.
Okay.
Because I'm rolling out these dementia prevention consults.
Okay.
But hey, I mean, if another doctor's interested,
we need
come join me, and we can see more patients.
Perfect. So I'm just gonna ask you 3 quick questions. How does the community go? Where do they go to contact you?
So it'll be Aline Health DPC.com. Okay. So ALINE, the word health, and then 3 letters, DPC, like direct primary care.com. And then Vital Op Wellness is www.vitalopwellness.com. VITALOP wellness.com.
Gotcha. Perfect. And those will be in the show notes for people to find. Yeah. So where are you located in the Shreveport-Bossier City community?
I am on Line Avenue, 2210 Line Avenue. Right across from Mid-City Pediatrics, right down from Byrd High School.
Yeah. So, if you have kids, you know where Mid-City Pediatrics is. And why should our community use Aline Health DPC? I know you're on pause right now.
Yeah, sure. I think that it's just another option. It's another tool in our toolkit. I feel like it's a chance to have, like you mentioned, price transparency. Most people are not averse to paying for healthcare. They just want to know what they're going to pay. Yes. So price transparency, efficient care, more convenience, more time. So it's just another option in the medical system.
Yeah, I love it. We need options.
Yes.
I like options. So now, Megaphone Minute. You just tell us for a minute whatever's the most important thing for you.
Well, that's definitely my faith.
Okay.
My Lord and Savior Jesus Christ. Yeah. That's my foundation. That's what kind of drives me through when I'm raising my children, through my clinic, helping my patients, when I hit challenges. There's definitely valleys, but there's always peaks.
Yes.
And that is my sustainer. I think I love plants and gardening, and so I'm excited. It's about to be spring to get outdoors. And then, of course, my family, my children, my husband, my extended family, my mom, and my friends. So I just think focusing on faith, family, and health.
Yes.
And I don't know that you can go wrong.
I agree 100%. 100% I agree with that. So awesome. Well, Dr. Crow, thank you so much for being on the podcast. I really appreciate it.
I appreciate it too. Thanks, Jeremy.